Hello and welcome to our Healthy Steps session, Living a Heart-Healthy Lifestyle. We are happy to have you join us today, and we hope that today's presentation will serve you well. We will focus on learning about how eating a heart-healthy diet and making other lifestyle choices can help reduce the risk of cardiovascular disease. The agenda for this presentation includes a check-in along with setting SMART goals, why follow a heart-friendly diet, dietary suggestions to support the heart. We will be taking a look at types of fats, fiber, sodium, and other dietary considerations. Portion control using the plate method with a focus on hunger and fullness cues. And lastly, resources to help support you after today. Check-in. Before we begin, please take a few moments to check in. You may want to pause the presentation for this reflection. Reflect on goals you've set from other Healthy Step sessions, webinars, workshops, self-help books, or maybe appointments with other healthcare providers. Take this time to reflect and consider what is going well and/or what has been challenging. As we go through today, try to consider where you are currently at and decide on one or two things you could work on and ensure it is a SMART goal to help set you up for success. Share with family, a friend, or even write it down on pen and paper for yourself to help stay accountable. You can ask yourself these questions. What needs changing? Why do you want to change? What is your motivation for change? Do you have the capacity right now to change? On a scale of 1 to 10, how confident do you think you can make the change? And how can you make your goals SMART? S for specific, what exactly are you trying to achieve? M for measurable, how will you know when you've achieved it? A for attainable, is it genuinely possible to achieve it? R for relevant or realistic, why are you setting the goal you are setting? And T for time bound, when do you want to achieve this by? Why follow a heart-friendly diet? Following a heart-healthy, friendly diet, along with other lifestyle choices we will review shortly, can help reduce your risk of cardiovascular disease, or CVD. CVD, or hardening of the arteries, is caused by fatty buildup in the walls of the arteries over time, as seen in these photos. This buildup causes the artery to narrow and can stop blood flow. If this happens, it can lead to angina, otherwise known as chest pain, a heart attack, poor blood circulation, or a stroke. This cartoon shows the doctor saying to their patient, to prevent a heart attack, take 1 aspirin every day. Take it out for a jog, then take it to the gym, then take it for a bike ride. In addition to diet, which is what we will be covering today, an active lifestyle can help reduce your risk of heart disease and stroke. What else can you be mindful of? While most might be able to work on improving their diet or increasing their physical activity levels to some degree, there are other areas in your life that you may have some control over to also reduce your risk. For example, choosing to be smoke-free, getting adequate sleep, and/or managing stress levels. The more risk factors you have, the greater your risk of cardiovascular disease. Keep in mind, there are some factors in our lives that we cannot control. For example, being over 40 years of age or having a family history of high cholesterol. This cartoon shows the patient telling the doctor, I try to eat healthy. I never sprinkle salt on ice cream. I only eat decaffeinated pizza and my beer is 100% fat-free. There is a lot of information out there with nutrition, and sometimes this can be pretty confusing how to apply it. In today's presentation, we will go through some specific things you can focus on in terms of diet. What are blood fats, lipids? They can include cholesterol and triglycerides. Why are we concerned about them? Well, abnormal fats can increase your risk of heart disease and stroke. To start, blood fats, lipids is another name commonly used for cholesterol. Cholesterol is made in your body by your liver. Small amounts are important for many bodily functions, such as producing bile, hormones, and vitamin D. Too much cholesterol can build up in blood vessels and block blood flow to your heart. This can lead to heart disease, stroke, or both. There are two types of cholesterol. HDL takes blood cholesterol back to your liver where it can be removed from your body. High levels are healthy for your heart. LDL leaves cholesterol in the walls of your arteries, causing them to narrow over time. High levels can lead to heart disease. Triglycerides are fats made by your body and are a type of fat in your blood that your body uses for energy. You need some for good health, but high levels are linked to a higher risk of coronary artery disease. High levels can raise your risk of pancreatitis. Dietary suggestions, types of fats. There are three main types of fats: trans fat, saturated fat, and unsaturated fat, which includes our polyunsaturated fats and our monounsaturated fats. Choosing foods with unsaturated fat more often instead of foods with saturated and trans fat can help lower your risk of heart disease. Trans fats. Health Canada has banned artificial trans fats. It is illegal for manufacturers to add partially hydrogenated fats to foods sold in Canada. They have been shown to increase bad cholesterol, the LDL, and decrease good cholesterol, the HDL. Trans fats are not needed for a healthy diet. You want to minimize or eliminate foods with trans fats. They can still be found naturally in some animal-based foods in small amounts. They occur naturally in foods such as beef, lamb, and dairy products. Saturated fat can raise your cholesterol, often found in baked goods, meat, dark poultry meat, poultry skin, butter, and coconut. Unsaturated fat. Healthy fats do not raise your cholesterol levels. They include the unsaturated fats, specifically our polyunsaturated fats found in fatty fish, which are a great source of omega-3 fats, and sunflower oil, which is a source of omega-6 fats. Monounsaturated fat found in olive oil, sesame oil, nuts such as your almonds, cashews, and their butters, and avocados. Fiber. Do you know the two main types of fiber? There are two types, soluble and insoluble, and both are important for good health. Most Canadians only get half the amount of fiber they need each day. Aim to get a total of 25 to 38 grams of fiber a day. Fiber has many great benefits. As noted, it can help lower LDL cholesterol and triglyceride levels, balance blood sugars, delay stomach emptying, and help with regular bowel movements. Fiber can be found in a variety of options, such as dried or canned legumes, like kidney beans, black beans, chickpeas, or lentils, whole grains, such as oats, oat bran, barley, buckwheat, bulgur, or quinoa, fruits, such as apples, strawberries, pears, and prunes, and vegetables, like carrots, corn, broccoli, or Brussels sprouts. Before you increase your fiber, be sure to drink enough water. A common recommendation is 6 to 8 cups a day of fluids, but some people will need more or less. Please speak to your healthcare provider for what is right for you. And go slow. Your body will need to adjust to more fiber in your diet. Increasing too quickly or without drinking enough water may cause gas, bloating, cramping, diarrhea, or constipation. A heart-healthy diet is lower in sodium. Do you think most of our sodium comes from salt added at the table? Most of the sodium in our diet comes from processed foods, restaurant, takeout meals. Consider ways to lower your sodium intake by cooking at home with whole foods more often so you can control what's added to your cooking. Take the salt shaker off the table. Try seasoning your foods with herbs, spices, and lemon juice instead. Eat less deli processed meats. And eat less processed convenience foods that are high in salt or sodium. Other considerations. Dietary cholesterol. The focus has shifted away from cutting out dietary cholesterol, as it had been shown to have less of an impact on blood cholesterol levels than foods with saturated and trans fats. Plant sterols. These are common compounds found in plants that have the same structure as cholesterol. They are naturally present in small amounts. A typical diet only provides about 0.2 grams. 2 grams a day has been shown to lower LDL by 6 to 12%. You may find these as supplements or in fortified foods. Sugar. Excess intake of added sugars can increase blood triglycerides and decrease the good HDL cholesterol. Some studies also show that excess added sugars can play a role in increasing blood pressure and inflammation. What about alcohol? Guidelines were recently updated this year from the old 2011 guidelines, and they are drastically different. Science is evolving. We now know that even a small amount of alcohol can be damaging to our health. If you drink, it's better to drink less. For many years, there was a commonly held belief that drinking in moderation offered protection against heart disease. This was widely publicized. Research in the last decade shows a little alcohol does not increase or decrease our risk of heart disease. Actually, at high levels of use, alcohol is a risk factor for most types of CVD, such as coronary artery disease, heart attacks, heart failure, high blood pressure, AFib, and stroke. Portion control with a balanced plate. For balanced meals, you can divide your meal into sections, and this can also be applied to mixed dishes. Aim for 25% whole grains, starch, 25% protein, and 50% vegetables. Please be mindful of hunger fullness cues and allow yourself to have some flexibility with this tool if needed to feel satisfied, comfortable, and well-nourished. This cartoon shows someone talking to another person, saying, if you swallow potato chips without chewing, they act like little snowplows and clear all the cholesterol out of your arteries. Be careful of the nutrition information you hear out there. Nutrition is a newer science, which makes it fun, but sometimes challenging as new information is constantly being presented. What moves you? Being mindful of other healthy steps we can focus on and thinking outside of nutrition is to consider how you're moving your body. Recognizing the health benefits of physical activity. Immediate benefits can be seen with improved sleep, less anxiety, reduced blood pressure. Long-term benefits can be seen with improved brain health, heart health, cancer prevention, achieving and supporting your best weight, bone strength, balance, and coordination. Taking stock of self-care. Consider different aspects of self-care and what you could do to support it. Physical, taking a walk. Psychological, using a journal. Emotional, watching a funny movie. Spiritual, meditating. Personal, spending time with family. Or professional, taking a new class or course. Please visit this website for more information on the self-care wheel. In summary, you can improve your cardiovascular health by enjoying a variety of vegetables, fruits, whole grains, fiber, and unsaturated fats. Reducing your sugar, salt, saturated, and trans fat intake. Quit or not smoke. Control blood pressure. Control blood sugars. Be physically active daily. Get adequate sleep. Control stress, and limit alcohol intake. Reach out for support. Please check out our website, newvisionhealth.ca, for different workshops we offer, including our Walk and Talk program, where we meet at a local place to walk and connect. On our website, you'll also find a link to the Waterloo Wellington Self-Management Program, and they offer many excellent workshops. Lastly, we note a few online and app options for you to check out if interested. Health behavior change is a process. We can compare this to growing a plant. First, you plant the seed, then you nourish it. Set some plans to change in motion. Initially, it needs more care, but eventually the roots will take and the plant will flourish. Hiccups may emerge. Eventually, the plant becomes resistant and will thrive. This is similar to thinking that over time, the energy it takes to keep the change going feels lighter. When habits don't stick, is it an automatic failure, or can you see it as an opportunity to learn and grow? Set your plan in motion. As a reminder, set yourself up with better success by setting SMART goals. Pause the presentation to review these questions. Some examples might be, I will enjoy a quarter of a cup unsalted nuts 3 times a week for a source of unsaturated fat in my diet. Or I will prepare 2 lunches at home instead of eating at restaurants every day during my work week. Thank you for listening.